This is Allison. She's nestled snugly inside her mother's womb, cradled by the warm, protective amniotic fluid. It's a nurturing environment that helps her grow strong. But something unexpected has happened. Allison has released her first stool, called Meconium, into the fluid that surrounds her. Normally, babies wait until after birth to pass meconium, but occasionally, if a baby feels a little stressed or simply decides it's time, they may release it early while still inside the womb. This can pose a risk because if the meconium enters the lungs, it may lead to breathing difficulties. To keep Allison safe, the doctors made a careful decision to deliver her through a cesarean section. This procedure allows the doctors to bring her into the world through a small incision in her mother's abdomen, ensuring a safe delivery. As Allison is born, the nurses and midwife act promptly to ensure her safety. They begin by gently cleaning her skin to remove any meconium that may have passed during birth. Using soft, sterile cloths, they carefully wipe her body, paying special attention to areas where meconium might have settled, ensuring her skin is free from any residue. Before Allison was cleaned, the doctor performed suctioning to clear any remaining meconium from her mouth and throat. This crucial step helps prevent meconium from entering the lungs, which could lead to breathing difficulties. The doctor then cut the umbilical cord, completing the delivery process. Once Allison was thoroughly cleaned, she received a vitamin K injection. This routine procedure is important for newborns as vitamin K plays a vital role in blood clotting. It helps protect against bleeding disorders in the first days of life, ensuring that Allison's blood coagulates properly and reducing the risk of any complications. Allison was weighed at 3.98 kilograms, which is above the 90th percentile for her gestational age and gender. Her size was likely influenced by her mother's advanced maternal age and undiagnosed gestational diabetes, which can sometimes cause babies to grow larger. To understand why Allison needed immediate care, it's important to look at the events leading up to her delivery. During early labor, Allison's heart rate was elevated, exceeding 180 beats per minute, indicating fetal tachycardia. Additionally, she showed signs of macrosomia with excess body fat noticeable at delivery. These signs of fetal distress, coupled with the presence of thick, dark green amniotic fluid when Allison's mother's water broke, led the medical team to perform an emergency cesarean section. The greenish material in the amniotic fluid, meconium, formed as a result of the baby swallowing the amniotic fluid during pregnancy. It contains debris such as mucus, bile, and the baby's body hairs. About 1 in 10 babies defecates before birth, usually associated with fetal distress. Meconium-stained amniotic fluid is often linked to several conditions including placental malfunction, hypertensive disease of pregnancy or preeclampsia, diabetes, post-date pregnancy, intrauterine growth restriction, and increased maternal age. Thicker and darker meconium is often a sign of fetal distress, typically caused by a lack of oxygen. This oxygen deprivation increases the baby's bowel activity and relaxes the anal muscles, causing the meconium to be released into the amniotic fluid. If the baby inhales or swallows this meconium, it can lead to respiratory complications, such as meconium aspiration syndrome. After birth, Allison's blood sugar was assessed due to her history of being large for gestational age and the appearance of excess body fat at delivery. The doctors discovered she had hypoglycemia, a drop in blood sugar. To help her recover, Allison was placed on a glucose drip to stabilize her sugar levels. Over the next 48 hours, the medical team closely monitored her to ensure a smooth transition to life outside the womb. As part of the ongoing evaluation, the doctor placed a soft, tiny sensor around Allison's wrist. This is a neonatal pulse oximeter used to monitor her oxygen levels and heart rate, providing crucial information about her respiratory and cardiovascular health. Newborns, especially those born under stress, need their vital signs closely tracked to ensure their bodies are adapting well to life outside the womb. Monitoring Allison's oxygen saturation and heart rate helps the doctors assess how well her lungs and heart are functioning. You might also notice that Allison is salivating a little. This is perfectly normal for newborns, as their bodies work to clear excess fluid that may still be present in their mouths. After being surrounded by amniotic fluid in the womb, some newborns take a little time to expel this moisture. The medical team is paying close attention to make sure Allison is clearing it effectively, ensuring her airways are clear. As Allison lay face down on the table, the doctors and nurses carefully observed her. In these moments, the medical team is evaluating her vital signs and overall condition, ensuring that her breathing, heart rate, and reflexes are normal. This face-down position helps clear any residual meconium or fluid that might still be present, allowing gravity to assist in draining any secretions and easing her ability to take her first breaths. Allison is carefully monitored, her color, muscle tone, and responsiveness all watched closely as the team makes sure she's adapting well to life outside the womb. Every action, from checking her oxygen levels to gently stimulating her, is designed to give her the best possible start. The swift response and ongoing assessment ensure that Allison's transition is as smooth and safe as possible. Thanks to the swift and attentive care of the medical team, both Allison and her mother are safe. After 48 hours of careful monitoring, Allison is now healthy. Her blood sugar levels are stable, and she's ready to embark on the beautiful journey of life. For more educational and fun stories that help kids learn and grow, don't forget to subscribe.